Hey, how's it going, everyone? It's Mark here. It's December 9th, 2024. Back in August of 2024, I made a video about some blood work that I was doing. It was August. I I thought I would have the another result relatively soon, but there was a few hiccups with my doctor's appointments and things of that nature. So this is part two of that video. So just a little bit of a recap. In mid 2023, in August, I went to Carnivore, which is a very strict low carb way of eating, and became super energetic and healthy. And I lost a bit of a bit of weight, and everything was going super good. In December, I had an appendix problem. I had to go into to the hospital and I had my appendix removed. It was not related to my carnivore journey. But anyway, in January, I think I got, was late January, I think, or something like that, that I got my blood test and everything looked really good. As you can see by the February 24th column, you can see all the greens and the check marks. So complete blood count, all good. WBC differentials, good. Biochemical, I had ferritin here. Typically, it's not something that's checked. So that was out of spec on the high side. Um, then the routine chemistry was fine. My A1C was 5.6, and I have some other stuff in a second slide here. In June 2024, basically the main reason that I had that check done was to confirm or to double check the ferritin. You can see it went down a little bit from 781 to 718, but I wasn't very happy with that result. So I did a lot of homework and I actually donated blood in between June and November here. This is supposed to be a good thing to do. Um, Now, recently I took another test in November, and you can see that everything on the blood count is all good. The differential is good. Right below the ferritin, you can see iron, transferrin saturation, and TIBC. Those were added because of the high ferritin, so those were all good. Also, the INR study was added. That was good. The all of the routine chemistry was redone. That was all pretty good as well. Um, and I'll talk to you about the bottom part of this. Okay, so this is just the bottom part of that report. You can see a lot more red from the February and the June results. um, February, I wasn't fasting, so I messed that up. Um, that's usually impacts your triglycerides a little bit, maybe your A1Cs and stuff like this. Um, but what I was seeing is I was seeing my HDL was too low. HDL is the good cholesterol, it's supposed to be high. And then the other thing that I was seeing in July, which is the middle column, and also in November, you can see a very good trend improvement on the triglycerides to HDL ratios, which are the two bottom ones. It's supposed to be less than 0.87 in metric and less than 2. And you can see from February, August, and November, you can see a strong downtrend that actually trending in a really good direction. Okay. So again, not very concerned with high LDL because I am healthy, but it is stabilizing, as you can see, and that's typical for a low glycemic or like a high what is it called? Um, Anyway, for someone that's on keto, low carb, it's relatively normal for LDL to go up a little bit and sometimes stay up. Um, but as long as you're metabolically healthy, that's fine. But those two trends are going in a really good direction. I added my fasting glucose, which is also good, lipo A, which is also good. Um, there was also some alpha 1 feta protein that was added. There was a bunch of serum proteins that was added. A lot of that is to check my kidney, and that's because my ferritin number was high. So my general practitioner doctor referred to a kidney specialist to make sure that there was no problems with my kidneys. And so far, everything looks really good. So I'm pretty happy with my test results. Um, One thing that I'm going to do is I'm going to continue to give blood as often as I can. This should lower my ferritin. Um, I also want to keep my A1C to go down, hopefully, as well as my fasting glucose and fasting insulin. Um, and we'll keep an eye on my cholesterol. But yeah, everything looks pretty good. So I'm going to keep doing what I'm doing. Um, it's December 2024, so I'm going to run into 2025 with basically the same approach. I'm going to do some exercises and I'm going to get back on track in general. So, wish you all the best. If you have any questions, I'm not an expert, I'm not a doctor, this is not medical advice, obviously, but if you do have questions about different parts of your blood work, I've been digging into it a fair bit, so I might be able to help or I might be able to point you in the right direction. Otherwise, please add some comments, like, subscribe. Would really appreciate it. Would help the channel. Trying to grow my channel a little bit in 2025, and we'll be following along on my carnivore journey. So thank you very much. Take care. Bye for now.